Good morning, everyone. Welcome to this webinar. Thank you for honoring our invite. Thank you for being here for this very important discussion. My name is Patricia Jacqueline, and I'll be your moderator for today. So briefly, before we get into this, I would love to introduce the body that has enabled all this to happen, and that's the Pharmaceutical Society of Uganda. 10 hours. So the Pharmaceutical Society of Uganda is the professional body for pharmacists here, and it was established in 1970 under the Pharmacy and Drugs Act. It's responsible for the ethical conduct of all pharmacists in Uganda. So they have made it possible for us today to convene and be able to discuss the issues we'll be discussing today. I'll start with a brief introduction about myself. As I said, my name is Patricia Jacqueline Nsanze. I am an intern pharmacist currently in Mulago Hospital. I'm also a mental health advocate. I've worked with a couple of organizations still to do with issues of mental health. I've worked with Makere Joint AIDS Program, still in the area of HIV and mental health. I've worked with TPO Uganda, which is responsible for psychosocial support and psychological first aid, mainly to refugees in a couple of the refugee camps here in Uganda. Currently, I'm working with Mulago as an intern pharmacist. And on the side, I'm also a mental health advocate and a founder of a youth organization called The Sanctuary. I'm very passionate about women empowerment, literacy, and mental health. So I have the great honor today of introducing our eclectic panel, people from diversity, from different fields in the same niche. We have a psychologist on board, we have a psychiatrist on board, we have a pharmacist, all who work within the sphere of mental health. So I'm greatly honored to be inviting these people. They are pundits in their area and they are top of their field and they are great at what they're doing. So today I'll begin the introduction with our first panelist. Her name is Miss Patricia Caballo. She's a psychologist and a mental health advocate. She's especially passionate about promoting healing and wellness. She currently works with Metro Health International Uganda, a hospital slated to open by the end of the year. She's also part of a social media health campaign called Thrive Uganda, where her and her counterparts have created a safe space for everyone to learn, share, and heal, especially dealing with issues of mental health. So welcome, Patricia.
Thank you very much.
Our second panelist is Dr. Raymond Odokonyero. He's a prominent Ugandan psychiatrist, a lecturer at Makere University, a public speaker, and an author. Dr. Raymond is a multi-person. He's a mental health advocate. He's a regular writer in Uganda's leading newspapers. I've read a couple of his articles. He's a storyteller and a sportsman. He's an internationally accredited addiction practitioner. His research interests are in the areas of substance abuse and HIV, especially among young people, and he's very, very vocal about helping young people, especially in campus. Raymond's interests include reading, rugby, travel, bonding with people, and growing vulnerable trees of northern Uganda and rare tropical fruits. He's a man of, many talents. So welcome, Dr. Raymond.
Thank you, Jacqueline.
Our third panelist today is Dr. Wikiride Gad, who's a senior pharmacist at Butabika National Referral. He's the chairperson of the hospital's contracts committee. He's a pharmacist with hands-on experience in general management, a niche in procurement and chain supply. He's dedicated to promoting public initiatives and improving community mental health. He holds a master's in business administration from Uganda Matters University and a bachelor's degree in pharmacy from Makere. He's currently pursuing a master's program in pharmaceuticals and health supply management at the College of Health Sciences, Makere University. Thank you so much for Dr. Gad for honoring our invite. You're welcome.
Good morning.
So before we lift off, I would love to send a couple of messages to our audience. This webinar will be recorded and it will be made available on the PSU YouTube channel. So in case someone has missed out and you feel that this discussion is pertinent, you can always direct them to our PSU channel. It will be made available there. Then we're reminded to turn off our audio and our video so that we can have a successful webinar without interference. And in case you have any questions, please write them down and send them to the Q&A or chat box, and please address the question to the panelist who you feel would answer your question very well. Then at the end of the webinar, there will be a feedback form. So please endeavor to fill that so that we can be able to know what we did right and what to do and improve the next time. Thank you. So we're going to begin this discussion on some of the core foundations of what we're talking about. Today is our 8th webinar, and the theme is mental health in light of the COVID pandemic. So we want to know more about mental health, and we want to also understand how the pandemic has affected mental and with the unprecedented beginning of the COVID-19 pandemic, a lot of our sectors have been affected, from education to transportation to agriculture to health. And today we're going to be focusing on mental health. So we would love to know what is mental health briefly, and also understand what psychosocial impacts has the COVID-19 pandemic brought on the population and their emotional well-being. Yes, Patricia.
Thank you very much, Jacqueline. I'd like to begin mental health is a state of well-being in which every individual realizes their own potential, can cope with daily life stresses, can work productively, and is able to make a contribution to their community. So what are some of the risk factors when it comes to mental health? Biochemistry is one. The differences in the chemicals in the brain can offset someone's mental health. Genetics, studies have shown that if one twin, let's say, suffers from depression, chance that the other twin will suffer another mental health challenge at some point in their life. Personality, people with low self-esteem are prone to mental illnesses such as depression. Environmental factors, exposure to violence, neglect, abuse, and disease. So these are some of the risk factors surrounding mental health. When it comes to COVID-19, especially in Uganda, some of the psychosocial factors that have affected the public, first of all, is poverty. COVID-19, as you mentioned, just came and we weren't prepared for this, and many people have had to stay home. Many employers have had to let go of some of their employees. So this has really changed the way we look at life and the way we go about life in general. So one of the main factors is poverty. People who are unable to go into work, people who are unable to earn a living, maybe from their day-to-day activities, are now going through a lot of stress, a lot of anxiety about the future, about how tomorrow will be, about how they'll fend for their families. And we have also seen a rise in domestic violence. There have been a couple of cases reported, and unfortunately, from some of those cases, there have been homicides and a suicide reported. So we have people who are now on lockdown, and some of them are not in very favorable environments. Some of them are in abusive homes. So we have people dealing with that, with the violence, with anxiety, with the depression, with the emotional abuse. And from all of that, there's things like stress that come about that now cause anxiety, depression, and other underlying mental illnesses or conditions, and now aggravated or if someone's now living with a chronic illness and they have to worry about, for example, being able to get the medical care that they need, or being able to go to the hospital with a lockdown and curfew and all of these issues arise. Unfortunately, we've heard of a couple of stories of pregnant women who weren't able to get to the hospital in time and have unfortunately lost a child or lost their lives. So there are a couple of factors affecting the mental health of Ugandans at the moment. Together with Thrive UG, Otita, and the Heaven Project, we're currently conducting a study to assess the impact of COVID-19 on the mental health of Ugandans. So far, we only have about 27 responses, but there is already, the study's already showing a rise in anxiety, a rise in poor sleep patterns, poor appetite. So hopefully over time, we'll be able to analyze this data and get a better picture of just how COVID-19 has affected the mental health of Ugandans. I don't know if that's, Jacqueline, please let me know on time because I know I only have 10 minutes. Yeah.
You can still go.
Okay. So when it comes to the psychosocial factors, maybe someone out there who's listening to this may be wondering, how do I know I'm going through a tough time, that's something that may affect my mental health in the long run? I'd like to maybe go through some signs and symptoms, things that you can look out for. Sleep and appetite disturbance, difficulty in thinking and concentrating, a loss of motivation, thoughts of death or suicide, excessive self-criticism, and social withdrawal. We now have people who were able to go out to work, who were able to go out in social situations, even though they had an underlying mental health challenge and appear as though they're functional. So now what COVID-19 has done is that these people no longer have that to go back to. They no longer have, you know, the freedom to go into work and kind of get things in place. So now they have to sit at home and actually go through all the emotions and the stresses that COVID-19 has now upon them. So we're very functional people that are now suffering in silence and going through a very tough time. So I'd like for anyone who's maybe listening to this, if you know anyone or if you're going through this, just take a look at certain patterns in your life and what has changed. And maybe just a few tips. I could share a few tips on how to go about this. I'm very passionate about raising awareness for mental health, and I believe if we all continue to have this conversation and reduce the stigma, we'll be able to create the opportunity for people to get the help that they need, and people won't be suffering in silence anymore. So if you're able to reach out to a friend or talk to someone, and I urge us all to be compassionate and kind and sensitive towards one another, and also seek professional medical attention. I'm very honored to be on this panel with a psychiatrist and a pharmacist. So seek professional advice to get a better understanding on what exactly it is that you're going through and how it is that you can overcome that mental health challenge. Some tips on daily life, things that you can do. You can exercise, you can eat well, start a diet probably, and also journal. I understand that many of us may not be able to go in to see a professional right away, or we may not be able to talk to a friend or family member. So start journaling, start writing down your thoughts, your feelings, and eventually what this will do, first of all, it will create a release for built up emotion, and it will also help you in the long run to see a pattern as to where your triggers came about. Stay away from alcohol and drugs, as these usually aggravate the situation, and also follow up with therapy for those in isolation. we are aware that there's some people that are currently in quarantine. So I'd like to appeal for us to maybe from this discussion, we can find a way to provide support for them. And perhaps Dr. Raymond may know a little bit about that and what the government is doing to help these people in the quarantine. But I think that's for me for now, Jackie.
Thank you, Patricia. Thank you so much for that candid discussion. We're going to be taking it to Dr. Raymond right now. In low-income countries like Uganda, many restrictions have been put up to curb the pandemic. And because of these restrictions, certain issues have also arisen. There have been reports that issues on service access has been reduced. And I'm wondering how the people with mental health issues already are coping. So I'd love you to tell us how the access to community mental health services has been affected and how you have shaped the delivery of your services around the pandemic so that people can still be given access to these mental health services.
Right. Thank you very much, Jacqueline, and a warm hello to everybody who is joined into this webinar. I know my internet will be a bit shaky, but I hope some of the messages can come across. Panelists, I would like to appreciate PSU for organizing a webinar that is very close to my heart. The Pharmaceutical Society of Uganda has always been a strong advocate for mental health, and I'm always very impressed by how much knowledge and interest comes out of PSU in regards to mental health. Certainly, Jackie, during an emergency and a pandemic like this one, a subsection of health that has been neglected for a long time suffers even further. Even in what we would call normal circumstances, mental health services are themselves inadequate. And very little has been advocated for it. For instance, in the budgeting for mental health in this country, in the Ministry of Health, only 1% of the health budget is dedicated to mental health services. Of that 1%, about 80% of that has to go to the National Referral for Mental Health in Butabika. 20% has to serve the rest of Uganda. Now, clearly, the math just doesn't add up. We have 13 mental health units that have been set up in 13 regional referral hospitals who have to share 20%. The structure of Uganda's mental health care services are that we have a national referral in Butabika at the top, and then we have the 13 regional referral hospitals, all of which are doing a great job, I must say. These 13 regional referrals provide mental health care to the regions. And sometimes they also act as district hospitals. At the health center 5 level, that is at district hospital level, mental health services exist and they're under the auspices of a psychiatric clinic officer, as the majority do not have psychiatrists. And then we expect that health center 4s and 3s should have psychiatric clinic officers and or psychiatric nurses to provide services. So this is how the structure has been in normal situations. Now, certainly the COVID-19 pandemic came in as an emergency, and it has affected the way mental health services are being delivered. The biggest effect of it is not really in the care services being provided. All the units I've just mentioned are still open to the public for consultations and for care. There are some areas of it which have been affected. The most prominent being to get the service user to come to the facility. because they cannot transport themselves easily. You may also be aware that many of our patients are on long stay medications, and we've had to follow them up over years. So one of the things that we do is that when they are able to come, then we provide them with enough medication to cover a few months. Now that is Band-Aid. It can't help because it can't help all that much, because eventually what makes a difference is that we are able to see and talk to our patients and assess their care needs as per now. So if they are supposed to come back every month and they can't because they do not have transport, then that becomes an issue. The second thing was for the lower cadre health workers to be able to get to the facilities to provide services. So if you live far away from the facilities, as 60% of health workers do, they live more than 5 kilometers away from the nearest facility. Getting to the facility was also a challenge. So those affected service provision. But the government went around this by providing transportation for health workers. In Kampala here, buses were sent around to pick people from Wakiso and from Entebbe and the surrounding areas to bring them to, say, Mulago or to Butabika Hospital. So that was a great measure. All the facilities remained open, medications remained available, and anybody who accessed the health facilities was able to get care. I will say though that in a pandemic, one of the things that, or in an emergency for that matter, one of the things that becomes clear is that existing conditions increase in magnitude. Just like Patricia was saying earlier, that people had their existing mental health challenges, but with the pandemic comes new challenges. Things like anxiety because of the fear. Initially, when the pandemic started, the initial messages are rather scary. All the videos that come through in social media, they cause a lot of fear for many people. People lost sleep. In fact, the commonest complaint I get in the clinic these days is that of insomnia. And everybody is coming requesting for a benzodiazepine so they can go sleep. So that is a big problem now. Insomnia is a very big problem. The second one is there are unrecorded suicides that are happening in this country right now because of this pandemic. And most of the causes of these suicides are surrounding psychosocial issues, social disagreements, domestic violence, as Patricia said, and the like, and poverty itself. So all these have increased the amount of mental health burden that we are seeing in the clinics. Certainly people who are in isolation, people who are contacts, people who are suspects in this COVID have come up with a range of mental health problems. In the community, the biggest challenge right now is alcoholism, which is a bit ironic given that the bars should be closed and people shouldn't be going to drink. But we are getting a lot of people in withdrawal right now. In Soroti Hospital, 90% of the inpatient beds on the medical ward right now is being occupied by alcohol and alcohol-related problems. And the hospital was baffled as to why bars are closed and people are drinking even more. So when people do not have what to do, chances are they'll resort to things like that. When people are scared, chances are they'll want to find refuge in alcohol. When people don't have sleep, sometimes they think that alcohol will give them the sleep. So there are many issues that come with this. So the government efforts are definitely to be commended. I think the greatest one that I will share with you here is part of what I am doing right now, is that the government actually incorporated mental health and psychosocial support in the management of COVID. But this management of COVID didn't stop with only people who have the COVID or who are in isolation. We've extended it countrywide, and that's how I end up being in Hoima. So we are training health workers on how to, self-care right now during this pandemic, how to look after yourself and your children. We are educating anybody who attends to patients within a hospital facility to be able to look after themselves. And this is being coordinated by the Ministry of Health. It's a great stride in the right direction to be able to go around the country at such a time. Right now, we are in 13 regions of this country, and we'll be training people for 10 days. So this is part of the things that government has been able to do in an effort to ensure that this continue to run during this pandemic. Thank you.
Thank you very much, Dr. Raymond.
Yeah.
Wow, that was insightful. Some of the issues you have just talked about, I didn't have that particular information. Thank you very much. We're going to move on to Dr. Gad. As we have noticed, COVID has affected supply of commodities in many spheres, and not just particularly in health. So we would love to know and understand how COVID has affected the availability of health commodities and medicines, especially in the relation of mental health in this particular facet.
Thank you, Jacqueline. Am I on air? Yeah. Thank you all who are attending. Good morning once again. My name is Gad Ikirize. I'm a senior pharmacist at Tabika Hospital. Tabika Hospital, as the earlier on mentioned by Dr. Raymond, is the National Mental Health Referral Hospital. The hospital was designed to accommodate about 550 inpatients. However, as of now, we are accommodating 950 patients as of today's patient census. We see about 1,000 outpatients on a daily basis. So with the incoming of COVID-19, we realized that the need to protect our patients, especially those that are already in admission. So as a hospital, we took some of the serious measures, and one of them was to temporarily halt the operations related to other general public health services. So non-mental health patients were not reviewed. And so we concentrated only on mental health cases. However, we opened an assessment unit at the gate to do screening. We also opened a separate ward where we had to shift some of the patients. We opened a separate ward for isolation and possible case management. So right from there, you could see, as also mentioned by Dr. Raymond, we had issues of patients. Of the 900 who come for retreatment, refill, and review, most of them under lockdown could not access their medication, especially some on long-acting injectables that could not be easily accessed even in the private sector. So at that level, we had a disruption. But as you know, the supply chain can be traced way back from the manufacturers of active ingredients, APIs, to the manufacturers of actual pharmaceuticals, to the shipping and handling, and up to, as a government institution, our supply comes from national medical stores. And so medical stores, national medical stores also has to deliver to individual hospitals, and there then it can be distributed to the final consumer. With COVID-19, remember it started from China. China world over is known for the hub of production, especially APIs and also PPEs. So somehow at the onset, with that lockdown in China, there was that disruption to the supply chain. Uganda imports about 90% of our medicine, especially from India and China. And so with that lockdown at that global level, we had that disruption. And so to say that although we have not necessarily seen the exact impact of that global effect affecting us, especially in the access of essential medicine, we really anticipate that there will be greater need for essential medicine, especially now that the public transport has been opened. Hearing from Dr. Patricia and Dr. Raymond, you realize that as a hospital now, we are also preparing for greater influx of patients, those whose treatment has been disrupted and therefore have relapsed. But also, we are anticipating other new cases that are arising out of, the stress, the depression, the anxiety that has been alluded to by our previous speakers. So as a hospital, during this COVID-19, we tried to do stopgap measures. When we realized that we could not see many of the patients reporting to the hospital, we made arrangements with regional hospitals. Through communication, we are able to share part of the stock we had at Daruka Hospital with some of the regional hospitals, as well as some missionary hospitals that are strong in mental health, especially, for example, Chisi's Hospital. Through Ministry of Health, there is an electronic essential electronic system that can be used to track and also report the need for COVID-related supplies. This is a system that is donated by USAID, and through that electronic system, you are able to know where exactly in real time where there is need. And so with that, we have been able to share our stocks with those that are in need. One, because we realize that without many patients coming to receive medicine, we risk losing some of the medicine to expired through stockpiling. So we have opened for inter-institutional sharing of the available resources medicine. Secondly, we realized that about 80% of patients actually with this lockdown are not able to access public institutions. The nearest is the private sector, and we have seen private drugstores at the forefront. Especially this was alluded to by a research that was recently published by Dr. Mbonye Reddy in April under their survey. But the challenge is, again, that most of these private stockists do not stock mental health drugs. Reason is that they are expensive, but also our patients are the most vulnerable. They are not gainfully employed. Some don't even have, the carers do not actually have, like, spent all the money on caring for the patient. And so you realize that little money or little resources is only available for, family support and survival, especially in this lockdown. And so in relation to supplies, one, you realize initially there was panic in terms of purchasing, especially related to hydroxychloroquine and chloroquine. And so that disrupted by those who really depended on these medicines, especially the sicklers and people. We also saw a panic purchase in the private sector, especially where I've been practicing, of purchases of drugs related to anxiety and depression. And so that also somehow increased the prices of those drugs and limited access to those medicines. But even that, the lockdown generally, caused the disruption of the supply chain, especially to the final consumer. So, as a hospital, we also, opened up to patients that could send their treatment forms with the either bodabodas or bicycles. Even when the patient was not able to come, we are able to discuss on phone and actually do refill and the medicine would be delivered to the patient either by boda or bicycle. We also risk giving injectable, long-acting injectables like profenazine and haloperidol, and we trusted that the nurses in the nearby health facility would help administer those injections. All in all, I would say that the actual disruption of the pharmaceutical supply chain is yet to be seen. At the moment, as a hospital, we are preparing for the upside of new cases and relapses as we open the lockdown fully, as well as the public transport. We are in touch with the national medical stores. Even at the time of their lockdown, they maintain the e-system. And so we are, I would say that with the 80% of 1%, which Dr. Raymond said, we have utilized it fully to stock medicines in anticipation for the upside. However, we are still open to supporting other regional hospitals and the referrals in the case of any need. Whatever is available, the 1% that is available to mental health, meager as it is, I hope once shared, we can go a long way in helping our patients. I'm not checking on the time, but probably I could stop here a moment.
Thank you very much, Dr. Gad. Thank you so much for that insight. Wow. As a reminder, please turn off your audio and turn off your video for our audience so that we can have less interference. Thank you, Dr. Gad. Thank you, Patricia. Thank you, Dr. Raymond. Thank you for those contributions. So we have a lot of questions from the audience, but perhaps I have one of my own that I will address to Dr. Raymond. So in light of what has happened in the pandemic, we have been able to change up the ways we're delivering health services, mental health services. So as Dr. Gad had also talked about, phone calls are now being utilized. Moving forward, do you think that this is a feasible way of delivering mental health services even after the pandemic?
Yeah, Jacqueline, I think going forward, a lot of things are going to change about the way we do things. I can tell you that last evening, I got a phone call from somebody who was contemplating suicide. And they said that they had several strips of Valium by their side. They were sitting inside their car outside a hospital, a major hospital in Kampala. And that's where they intended to do this. And this person is a health worker, incidental. And that phone call lasted the better part of 1.5 hours. As of this morning, she's alive. So there's a lot that can be done using just the telephone alone, using media. I think the concept of e-health is really going to open up during and even post this COVID. Maybe that's going to become our new way of life. Many small changes have already started to be seen during the COVID. One of the noticeable ones is that a number of self-assessment websites have come up, some of them developed by Ugandans. Dr. Dickens Akena in my department developed the self-assessment for depression. He calls it the AVID, which you can find it on that www.avid website. So people are able to now assess themselves for signs and symptoms of mental illness and whether or not they may need to get in touch with services. So that is one. The other one is that there's renewed interest in mental health, something that people had taken for granted. Now people are starting to pay attention. I know what Patricia and her team have been doing in terms of mental health engagement and mental health literacy. I think that is going to become even more important to have the materials available on all the platforms, but should be in a language that people understand. Medicine is a difficult language. Psychiatry is even a more difficult language. But what the Haven project that I think Patricia is associated with has done is simply amazing, because people in the community are making skits of 30 seconds about their experiences with mental health and about and passing on their messages to the rest of the population. So this is going to become even more apparent as we go forward. Real thing, we don't have to sit with the patients now. I'm sure many people are going to find ways of billing, but they will provide the services by interfacing, sort of in the fashion in which we are doing right now. Dr. Twikirize said Butabika has engaged in this, and in fact, they are the industry leader when it comes to such engagements of the population. I think that Butabika can even still do a lot more, especially in being able to pass on the messages. I know every year they give the population 1 week of, everybody being able to just go to Butabika and interact with people. That is so good for fighting stigma. Anybody walks in kind of like the Parliament week, that's great, it's amazing, but it reaches only people around Kampala. This should go on and, should even go to the mental health units in the 13 regional referrals so that we can start this conversation and answer people's concerns. Stigma doesn't start from the fact that a mental illness is so disgusting. No. Stigma actually starts from small misconceptions that we have. Somebody with mental illness might pass it to me. People with mental illness are aggressive. Those kinds of misconceptions we can clear. So e-medicine is going to become the in thing, and I'm excited about the opportunities that lie in there. And I think PSU has a role there to find ways of engaging with e-medicine to provide mental health services to the people.
Wow. Thank you, Dr. Raymond. Thank you for answering that in detail. I have a question that is addressed to Ms. Patricia from the audience. Julius Chomia wants to know, social media has greatly affected many people's mental health, and yet it's the main platform for disseminating COVID-19 information. How can we strike a balance between the two in wanting to get pertinent information on the COVID pandemic and yet also protecting ourselves from some of the issues that go on online that could affect our emotional well-being?
Okay. Thank you very much. It is true that there's a lot of, first of all, fake news being shared, especially on WhatsApp. We've all seen those very long threads with all types of conspiracies around COVID-19. And what many people don't realize that some people are deeply upset by such messages. So my advice would be to follow credible sources. For example, the World Health Organization, Ministry of Health. If you follow credible sources, you'll be getting, first of all, breaking news, you'll be getting true news, you won't be getting any of those threads with conspiracies. So this would help with the anxiety that comes with reading news about COVID-19 and the fears that come with it. I hope that helps. Thank you.
Yes, thank you very much. That does help. I have another question from the audience that goes to Dr. Gad. From what we have seen, there has been a lot of detrimental effects as a result of the pandemic, but I hope that we have also had some lessons to pick from the pandemic. So from what we have picked up from the pandemic as lessons, how do you think that will affect healthcare, mental health care going forward from the lessons we've picked from the pandemic on issues about supply chain, on issues about service delivery? How do you think, as a result of the pandemic, some of those things are going to come to light, and how do you think that we can be able to use that information that we have gained during this pandemic to move forward in the mental health facet? Dr. Gad, please unmute.
Thank you very much, Jacqueline, for that important question. You know, with this challenge, we have to rethink the way we have been doing things. I want to agree with the Dr. Raymond that mental health is going to be very, very noticed. And so, not only mental health in terms of consultation and the diagnosis and consultation and other forms of consultation, as well as psychosocial support, but also in terms of medicine delivery. I think Pharmaceutical Society should begin right away looking into e-prescriptions as well. The possibility of, imagine this one has consulted the doctor online, and therefore we should also think about e-prescriptions as well as patient-to-patient deliveries. I also think that in the future, mental health and the associated care need to go way deeper so that we can begin working with the village health teams, just the way like reproductive health and the malaria control has done, we need mental health to go that deeper, so that at least at that level, someone is given basic information and basic tools to identify those who need mental health, urgently. We believe that early intervention will actually achieve much in terms of recovery and also in prevention of self-harm and also harm to others. But also, we need advocacy. It is very important that I'm seeing Dr. Patricia. Right now we are also working along with another organization, You Belong, Uganda, which is spearheaded by Dr. Brian, one of our senior consultants. We need many more organizations and civil society, to come out and advocate for mental health. In terms of the disease burden, the interest which Dr. Raymond is alluding to is coming out of, out of the stress and anxiety that has been associated with one, the misinformation, but also I think a deliberate propaganda for fear among the populace through media. So as we go forward, we need to rethink the way we have been doing things. We need total community involvement. We need civil society. We need funding. And also, as the supply chain managers, we need to make sure that supplies reach the population. Yes. One other thing I forgot to mention on the disruption, especially when I noticed that Dr. Raymond was talking about addiction, especially alcohol. We were supposed actually at the beginning of March have started our medication substitution therapy for opioids. We had everything arranged, including purchase of the equipment. But with this disruption, we are up now. We have not received our supplies as well as equipment. And so this, in a way, has greatly affected that specialized service. We had hoped that by now we would be fully operational. So, as I mentioned earlier, the effects will come later, but we need to think ahead, plan ahead, and act quickly, because time, as we saw in this pandemic, is of very much essence.
Wow. Thank you. Thank you, Dr. Gad. Thank you very much. Our time is almost fast spent, but we have a couple of questions that are burning, and I'm seeing many that are being addressed to Dr. Raymond. That as part of the COVID task force, especially in the area of psychosocial support and mental health, what are we doing for our health workers that are on the front line to be able to be guarded emotionally and also be able to provide the same mental health care to other patients? Because I'm sure that patients that have been diagnosed with COVID have some anxiety issues, some stress issues. So how have we equipped our health workers to pass on psychosocial support, and also what are we doing to also give them support that they need, because right now this is a trying time?
Yeah, Jackie, what is happening on the ground here is that the people that have been diagnosed with COVID itself, are not as much a problem as the people who are in quarantine. The people who are quarantined and they are waiting out 14 days, they're exhibiting more mental health symptoms than the ones who reached acceptance within the, the COVID case management field. So the ones that health workers are really now getting exhausted over are the people within quarantine and in the different areas where they have been quarantined. They're expressing symptoms of anxieties, depression, and sometimes even threatening self-harm and also harm to others, because when you threaten to escape from the quarantine area and come out into the community, then you expose other people. As for the health workers, what we are doing is that we are teaching them something called PFA, which stands for Psychological First Aid. Within a pandemic or within an emergency setting, we can't really do things as usual. And usually the population is so keen on seeing us end suffering of health workers. That might not happen. Our goal right now is to help them to function within this less than desirable situation or circumstance. So we are teaching them ways to self-care, to manage themselves, to be able to be honest with themselves for when they are overwhelmed. They should be able to voice it. They should be able to go back home and continue to interact with non-COVID people, talk to their children, call their friends. Things like that really do help to relieve some of the pressure that they're having right now. The other thing is that in the management, they are doing shorter shifts than it was the case before. So we expect that they're working shorter hours and they're able to go back home. And I think the ministry has done a good job to make sure that they are fully supported, that they have some food to eat, because it would make the situation far worse if health workers didn't, you left the hospital looking after other people and went back home only to starve. So some of the food that's been distributed has reached the health workers, which is a very good thing. And that helps to start that conversation. But for me, from a psychological point of view, I would like for people to be able to express themselves more, to acknowledge, to examine themselves and know when there's been a difference. Those changes in sleep patterns, changes in appetite, changes in weight, or even in interest. Those are things which could be indicators, among the other things that Patricia mentioned earlier. So we are teaching them to monitor themselves for symptoms and to also understand when they are burnt out so that they can get some rest, because a burnt out healthcare worker really becomes more of a danger to themselves and even to the patients.
Thank you very much, Dr. Gad. Yes, I have a question also from the audience. Since this is a platform for pharmacists, certain questions do come in accordingly. So I would want to get a view from Dr. Gad and Dr. Raymond as well. One of the audience members wants to know how and if you have incorporated herbal remedies into management of mental health care, as we know that the population, general population, really relies on natural remedies and herbs. And I wonder if you have found a way to incorporate herbal remedies into mental health care. Perhaps let's begin with Dr. Gad.
Thank you very much, Jacqueline. Herbal remedies, some remedies have been found to have some effects. However, there is need for further evaluation. We have seen patients reporting use of biringanya, for example, as a way of managing anxiety. But as pharmacists, we need to evaluate some of those things. Some vitamins and minerals have also been mentioned. Omega-3 has been mentioned, and St. John's wort has been also mentioned. I think pharmacists have a lot to do in terms of evaluation of the effects, together with clinicians. I think I see potential that we may need to exploit as pharmacists. But at the moment, a national drug authority has not notified any of the herbal products for use in the clinical setting, and therefore we do not actually encourage use of any evaluated natural products for management of mental health cases at the moment. There was a person, a healer who used actually to clone people, but we realized that he would get chlorpromazine, and when we evaluated his products, we realized that he was placing the herbals with the chlorpromazine, where even the dose was not calculated, and we had to, through National Drug Authority, to seek intervention, and the person is no longer active. Also, you realize that information is very key. People need to know that mental health is not spiritual, but it can be managed with science. And so I think with the now upcoming groups and the activists, I hope that information will reach people. The population needs to know that actually mental health can be managed by science, not by spiritual or otherwise.
Okay. Let's hear shortly from Dr. Raymond as well.
Jacqueline, I think that mental health in general already took into consideration traditional and complementary medicines. And we've actually been working hand in hand with traditional and complementary medicine practitioners. I personally think, and it's informed by Dr. Kathy Abo's research in 2012, she compared the psychotherapy that we give in hospital and the one that a traditional healer gives. And she found that they were very comparable. In fact, in some aspects, the traditional healer did better than us. They understood the patients better, they listened better, and they also charged in terms that the patients understood. So for me, I think this is a misstep. The process has begun. The Ministry of Health has incorporated traditional and complementary medicines into our protocols, but it's still going on very slowly. I also know that Department of Pharmacy has a whole unit for pharmacognosy, and they are studying effects of herbal products. That's a misstep that I think of this COVID we should be able to exploit.
Thank you, Dr. Raymond. We have a couple of questions, very many, and thank you for the audience for contributing highly. We're going to do one more question, and the rest of the questions that will not be answered here will be answered on our social media platforms. Please do keep on asking those questions, because this conversation is really important and we want to spread as much information as we can. This final question goes to Patricia from our audience member, Olivia. She asks, has the pandemic changed people's attitudes towards mental health disorders? Is there more awareness or acceptance for need of mental health help for everyone? How has the pandemic made people recognize that there's importance in prioritizing mental health?
Thank you very much. Thank you for that question. I would say there is an increase in, first of all, the conversations. Many people are starting now to to have these conversations at various levels, to understand what it is mental health is, and know that mental health doesn't equal a mental illness. So I have, through the work that I've been doing with Thrive Uganda, we've been reaching out, especially in social media. We have created a safe space WhatsApp group where anyone is free to share, to engage, and hopefully get the help that they need through the mental health professionals that we have on the group. So I would say there is a definite increase in, first of all, the search for knowledge on mental health. I would say personally, I have been approached by various people on social media asking to know more, to learn more. And I really do commend all the work that you're doing, Jackie and Dr. Raymond and Dr. Gad. And we do need to continue having these conversations and to put the right information out and to get people the help that they need. So just to wrap up, yes, I do believe there is better awareness, but there also is, false information out there. So for whoever is listening in, please ensure that you're getting your information from reliable sources, that you're talking to professionals, and that you're not listening to myths and misconceptions. Especially in the African setting, we tend to believe that mental health is related to curses, to these generational curses, and so many other things. So in your quest for more information on mental health, please ensure that it's from a reliable source. Thank you.
Thank you, Patricia. Wow, there are many questions, and I feel like we're denying so many people opportunities. One has been persistent, and I think perhaps Dr. Raymond should address this, and then we close. And I feel like it's really a pertinent issue. We have talked about e-prescription, e-health, and moving forward in that direction. So what would be the balance between need and risk? How would we be able to manage how to prescribe online and yet also manage the responses of the patients, especially for people who have issues like depression, anxiety? You've given out a prescription and perhaps you've never really met this person and be able to ascertain that they will not use these drugs perhaps for ill purposes, like perhaps committing suicide. So how can we strike that balance between e-prescription, e-health, and also providing adequate care?
Well, Jacqueline, it's quite easy. We have to educate the patients that we interface with. Every time we make prescriptions, one of the tasks of the health worker is to explain what this medicine is meant for, how long they are going to use it, what happens when they miss, what happens when they take too much of it, when do they need to come back to you, how should they discontinue the medication. So this kind of information, what we call psychoeducation, must happen to each and every patient. And in mental health, this is even more so because you have to give the information, but also test back and make sure the patient understood what you said they should do. So that is one, we have to psychoeducate them, the patients. But two, we also have what we call the proxy carers, the caretakers, if you like. In the management of mental health problems, treatment outcome actually largely depends on the recovery capital that the patient has. And part of the patient's recovery capital is himself or herself, their mindset, their attitudes, and things like that. But the other larger part is actually the community from which they come and the families in which they are raised. If the families are supportive, if the communities have the right policies, they have where to go to manage crisis. So those are the kinds of things that every patient should be assessed for when they come. It's not just about the prescription. You prescribe, and then you also interrogate their social capital or their recovery capital, and then you take advantage of that recovery capital. I don't know whether there was part A of that question.
No, it has been well answered. It has been well answered. Thank you so much to our panelists. I would love to extend our sincere gratitude to Dr. Gad, Ms. Patricia, Dr. Raymond. Thank you so much for sparing your time. And I think because of speaking out, ignorance will be reduced and stigma will be reduced. And, you know, more information is out there and it's such stigma reduces. So I'd love to thank you so much for being here. I'd love to thank also the audience for participating. Thank you for coming. Thank you for honoring our invite. A couple of questions have been asked and have not been answered. As I said, we shall be answering those on our social media platforms. And please do continue reaching out, asking more questions. We'll be collaborating with more professionals such as these because we want this information to get out because this is such a pertinent issue to be discussing. Thank you so much for coming. As we're ending, I would love to get maybe farewell messages from each of our speakers, our panelists. How should people deal with the COVID pandemic? How can we move forward? What advice would you be giving people in such a trying time? Let's begin with Patricia, and then we'll move to Dr. Gad and then Dr. Rain. Thank you.
Thank you, Jacqueline, and thank you so much for having me on this panel. I'm deeply honored to be a part of this conversation. Just some parting thoughts. I'd like to let everyone know that it's okay not to be okay. So I know with society and pressures, family and work, sometimes you feel the urge to put up a facade and act like everything is okay. Please know it's okay not to be okay. So find comfort in knowing that and reach out. We are here to engage with you. Feel free to join the Thrive Uganda platforms on Facebook, Twitter, and Instagram. And we're ready to engage more with you, to educate you more, and to know what you're going through. And please also remember that any two cases are not the same. So something that's prescribed for a friend of yours or a family member of yours will not apply to you. So try and deal with your individual case as holistically as possible, which is what we try to do as mental health practitioners. So thank you once again, and take care.
Thank you, Patricia. Let's hear from Dr. Gad.
Yeah, really, as a wrap-up, on the side of medicine, where I happen to have my background, it's to encourage patients not to self-medicate. The population should not self-medicate. They should report any unwanted or adverse effects immediately to their caregivers, who in turn will communicate to their doctors or pharmacists. But also on the, on the economic sense, on the economic note, where I also derive, a cup of tea. People should use sparingly their resources. Dr. Patricia mentioned those stressful moments, and Dr. Raymond, mentioned alcohol use. You don't solve a problem by creating another problem. So we encourage them to use their resources sparingly and for important issues, especially family support, and to seek care when it arises, and also report any effect of medicine, and to avoid self-medication. And also, as the Dr. Patricia said, social media and also television, people should avoid, probably limit the way the news, for example, their graphic pictures that are coming up. People should really avoid such graphic news, and also concentrate on positive. There is so much to do during even this lockdown, You can do self-improvement courses online. There are so many available. You can learn skills. And so people should not spend time lamenting, but should use their time to, to develop themselves.
Thank you very much. Let's please hear from our last panelist, Dr. Raymond.
Thank you very much, Jacqueline, for this opportunity for me to share with PSU. I want to thank the family of PSU for organizing this worthwhile webinar, and I hope there will be future opportunities for more of such series. The members of this meeting certainly become foot soldiers who spread the gospel. My parting shot in regards to these COVID times and mental health in general, I think for me it should be to the individual, to each and every one of us who is listening in. I think mental health should start with you. Sometimes it's common that we forget about ourselves and pay too much attention to somebody else's mental state, but we also have a brain that can easily not work right. Maintain social relations during this lockdown. A lockdown doesn't mean even your phone is locked down. It's important that you listen to somebody else's voice, that you converse, that you make plans for the future. Those are things that will help you to retain your sanity in a difficult period like this. So if I have one message for the people on this platform, is that they should retain their social relations, because part of mental health means you should be able to enter and leave relationships. So let's maintain the ones that we have. And I wish everybody a safe transit through this period and everybody's safety. And you take care of yourselves against this COVID-19.
Thank you so much, Dr. Raymond. Just a reminder, this webinar has been brought to us by PSU, the Pharmaceutical Society of Uganda, and we'd love to thank everyone who has been attending. Please endeavor to fill the feedback form at the end of the webinar, and please let's continue this conversation on the platforms, outside when we go. As Dr. Raymond said, we're now ambassadors, so please remember that, and please spread a little love, a little kindness to everyone that we meet, and also do not forget to take care of yourself. Thank you so much. We shall be ending here. This is the end of our webinar. Thank you to our panelists. Thank you to our audience. Thank you so much. Until we meet again.